All right, so thank you for joining us for the Meth 2.0 presentation and the naloxone presentation. We have Bob DeVries with MSTEP, which is a coalition up in Kingman, right, Bob? Did I have that right? Okay, sorry. Bob's been in law enforcement for 42 years. He's been employed with MSTEP for 2 years, but he's been active with them since the early 2000s. Now, before we get started with Bob, I believe we're going to have Shayna talk about surveys. Is that correct?
It is correct. Everybody's favorite topic of the day is going to be about data collection. So I'll just make this short and sweet just so that everybody knows. So there's been a few changes that have been made to the Meth 2.0, but we're going to continue both of the trainings that you're going to see today and the one that Ivy did yesterday. We're going to continue with the existing survey links as is for the remainder of the fiscal year. And I'll just drop out a couple of questions that may not be relevant any longer after the changes, but I need everybody to hear this. Number one, you need to do the surveys. That's the most important thing. But number two, continue to use the existing survey links, QR codes, and paper copies that you have for the remainder of the fiscal year that ends September 29th. Starting September 30th, we'll put out new links, new QR codes, and new versions of the paper surveys for you all to use so that we're starting fresh on a fiscal year cycle with the new data. Just want to be clear about that. Does anybody have any questions about that? I'm guessing probably not on a Friday.
Well, Shayna, this is Vicki Solomon.
Hi,
I
Vicki.
do have one question. I'm sorry. So just out of curiosity, is there any way on the new one when we do that, could we look at doing a retrospective instead
Nope.
of a post?
Nope. Yeah, no. So the agreement that we have with Access is that this will, because it is not an evidence-based program, right? The agreement that we have is that we're going to be doing a pre and post so that we can in fact determine that the efficacy gained was in fact from the trainings in and of themselves. So I don't have any latitude on that. We could spend all day talking about pros and cons of that. I know it's shorter and quicker for you, but it's not as effective for actually demonstrating effectiveness. So I don't have any latitude on that, Vicki. I'm very, very sorry. You are stuck with me. And you're stuck with pre-posts, so do the best that you can.
We definitely will. Thank you so much.
Anybody else? All right, Bob, take it away.
Thanks, Shayna. You're always a tough act to follow, but I appreciate it. And again, welcome everybody to the Train a Trainer. And that's how I'm going to take this today as we move forward, is talking about it from how you would be presenting it in your community. And the one thing I would like to emphasize primarily is that there is no one perfect way to do this program. What I'd like you to do is, as we go through this, if you have questions, please ask. But at the same time, do what is going to work best for you and do what is going to work best for your community is the key to what we're doing, and keep the message pretty much uniform across the state, because that's something very unique for us in regards to these different training programs. And Ivy is going to get us started here with the Meth 2.0. We recently made some adjustments to the program, and this is the latest and greatest that's going to be coming out and available to you here. Ivy, I don't know, maybe you can chime in. Is it on the toolkit already?
The new one, I don't believe has been uploaded yet, but it will be.
The committee's gone through it and made some modifications and just trying to make it better as we move along. So please, once I think they'll get the word out to you that it's up and available, and please use it as you see fit in your communities. But the biggest thing that we're going to talk about is Meth 2.0, and that's the new meth. And you may get some questions, well, what's different about it? Is it totally different? It's actually been refined, and there's a few other things that are occurring with it that we believe the communities and our residents really need to know about. And I apologize, my sharing skills with the PowerPoints is not the best, so Ivy's going to work the slides for us. So go ahead, Ivy. What the slides will pop up is what is meth, and that's going to be some of the sections, you know, as you're going through the program, is to talk to them that what we're going to talk about today is what is meth, Go ahead, Ivy. How big the problem is. And then lastly, what can we do about it? And so those are the three areas that we're primarily going to discuss over the course of it and that you would be dealing with in your presentations. Go ahead with the slide. Questions may be asked, is it the same as amphetamines? And no, it is not. It is similar in status, but it is not the same as amphetamines. It is a very powerful, highly addictive stimulant that can cause some significant problems, both short-term and long-term. And we'll talk about those later, but go ahead, Ivy. These are some of the things that you're going to hear possibly as street names: blue, crystal, ice, meth, speed. Depends upon your region. Some of these may not apply. Some of them may apply. All of them may apply, but there may be other things that you're hearing. And the best way you can find out as to how it's being discussed or talked about or trafficked in your area would be to talk with either your local police departments or your task force if you have one in the area. Go ahead, Ivy. And the biggest thing right now that we're seeing, and that's been the whole transition, and one of the other programs that's been put together by SACLA, is the whole social media aspect and the delivery of what's occurring. And it can come in the form of emojis. And these are some of the emojis that you may see that are directly related to methamphetamine. What meth looks like, and this is another one, when you look at these photos here on the left side, there is what we often would hear up here as shards. It looks like an ice shard. And the bag and the other smaller bags here with the emojis on them are all things that it may look like and appear in your particular area. It truly does look like a crystal ice.
Bob, I'm sorry, we have to stop for just a moment and pause this. This is the wrong PowerPoint, so I apologize.
Good trial run.
You did great so far, though, Bob.
Thanks, Joe. I appreciate that.
Give me just one moment. I apologize.
Sure. Got to tell everybody is I appreciate Ivy helping me out with this because my technology skills left when the 8-track player went away.
Okay, this should be it.
That looks right.
Can you see the second screen, the main?
I can see the main screen. Yeah, go ahead. You can go ahead and advance up to where we were with the photos.
Okay, wonderful. It is not being nice to me today. Why is it not?
Trust me, we just practiced this and it was good. There we are.
Okay, so
Technology
it's
is-
coming up, but it's not wanting to let me see what's
System
going.
Friday occasions. So.
Okay, so what are you seeing?
I'm seeing all of the slides on the left and the main one in the beginning.
Okay.
There we go.
Are you on the main screen now? You see the
Yep.
PowerPoint?
Yep.
Okay, wonderful. Okay, so let me get us back to where we were.
If you want to advance. And what you'll see on the PowerPoint as well as you should be able to see it now is some different talking points that do pop up with each of the slides. And this is right where we left off. We added the smaller bag on the right side of the screen that has the emojis. Essentially is because it's another way that you may find it in your community. Go ahead, Ivy.
Okay.
How meth is used is a question that you may get from the audience. And it can be done in a variety of ways, and it continues to change. Snorted, smoked, and injected are some of the most common, but we're now starting to see some new trends that we're going to talk about in just a little bit as well with a methamphetamine. Go ahead, Ivy. That's how it's smoked. This is one of the more common ones, is with the glass tube, the glass pipes that you will see as one of the more common ones from the smoking. They can pick these up in a variety of areas at your different shops, and they're really quite cheap, a couple of bucks for a glass pipe. So they're readily available, unfortunately, for individuals. Go ahead. How big is the problem is something really for you to emphasize, because we've made such an emphasis over fentanyl, which is a huge issue for all of us here in the state. But methamphetamine has never stopped being an issue. It's just we're looking at it from a different scope now, and things that we can emphasize to them. So go ahead, Ivy.
Bob, real quick, there's a question in the chat. Amy's wondering if we should be placing a trigger warning at the beginning of these PowerPoints.
I guess I'm not sure what you're referring to, Amy.
Lots of times when we're giving presentations in the community, we have people who are in recovery. And so the imagery can trigger them into a relapse. We've been told. I did a presentation for a church on fentanyl, and 6 people, there was about 50 people, and 6 people had to get up and walk out. They were all in recovery, and the pictures of the hypodermic needles and the spoons was too triggering for them. So I just wonder if maybe we could put something at the beginning of all these different PowerPoints to let people know that there will be images of drugs and drug paraphernalia throughout the PowerPoint, just out of respect.
No, it's fully understandable. And we'll definitely pass it on to the group to take a look at and see if we can plug it in there. If not, we can at least overall, collectively as a group, be aware, and that's something that you should be able to pass on. A very good point. Thank you. Go ahead, Ivy. What we want to talk to them about when we're talking about the new methamphetamine is the purity has changed. Go ahead. It's readily more available right now, unfortunately. It's far more dangerous, and it's much more deadly is what we're seeing. All of these things are a factor that have really given concern. Like I say, meth has been around for many years here, and we all have seen some of the aspects of that. But the new meth, really, the Meth 2.0 is significant, and it's a chance for us to pass on to the community the new dangers that are occurring with it. Go ahead, Ivy. This is what I think has been some of the most alarming, and you can click on the next one too, Ivy, is the increase in what we're seeing in methamphetamine overdose deaths. And we're also going to talk about the linkage between them and other drugs right now. But we are experiencing it here in Mojave County, and I'm quite confident that anybody that's on the Zoom today has experienced it in their counties as well. And if you have a fatality review team, that's an excellent source to go to find out if in fact what you are experiencing in your own counties. Go ahead, Amy. These are just some photos of some of the super labs that are in Mexico. The lower right one is also fentanyl that has been discovered hand in hand, which we're seeing in many of the areas right now that our drugs are tainted with the fentanyl. The methamphetamine, cocaine, even marijuana right now has traces of fentanyl in it. We've had 3 reports here of medications that have been coming across from the border from either a border pharmacy or a clinic that have been tainted. So put the caution out there is something that I think all of us can do and should be doing for people to be hyper vigilant when it comes to these types of aspects.
Recording in progress.
Just one more photo that we wanted to plug in here that clearly shows the super labs. We think back, for those that have been around here for a long time, that we're used to the little mom and pop labs, the small labs within a home, within a hotel room. This is what's coming out of Mexico now, and what has basically put the small laboratories out of business from that aspect because they can do it so much easier, bulk, and refined. This is something that, to be honest with you, in my law enforcement career here, that I really didn't think we would ever see methamphetamine fall from the #1 drug threat, because for years and years, methamphetamine was the top drug threat in Arizona. Last year, for the first time, it was replaced, and fentanyl took over that first spot. But you can see by the graph here in regards to seizures that have occurred, the methamphetamine is not going down because of fentanyl. It's actually increasing because of the fentanyl. We'll talk a little bit about that, but go ahead and click on the one, Ivy, if you would. And that just emphasize all the more what we're seeing is a 247% increase in methamphetamine seizures just in the past 5 years. And we're seeing them, it used to be years ago. And one of the things I encourage people to do is if you have incident stories, you can relate to something in regards to this, please convey them, because I think that helps send the message home to the individuals. But it used to be that you would see if in interdictions, marijuana, just strictly marijuana loads. Now we're seeing the interdictions that are occurring with a bulk of different drugs contained in the vehicles. Go ahead, Ivy, if you would. That's one of the scariest things right now is the purity level that is now coming from the methamphetamine is extremely dangerous. These super labs with the scientists that are working with them, they've been able to get it up to 97% purity. These are the things we're experiencing all the way down to the THC. And it's what's causing a future problem for us, already a problem, but I think a more significant problem is the psychotic episodes that are coming with this. I think we're going to see a real push in regards to where we can go more with that. Go ahead, Ivy. This is the other concerning part. We got the purity up and then the pricing drops. If you take a look at it, and 2019 is the latest figures that we have. If you have some up-to-date figures from your particular area, I would encourage you to use them. But the methamphetamine is less than half the value of what it was just a few years ago. So the pricing is just plummeted, and the availability and the purity is there. So all of these combined are a dangerous combination.
Bob, you
Right.
have a question with
Yes.
Amy.
Yep. Bob, and forgive me for not maybe understanding this, but when you say purity, I think of like heroin purity from the opioid, from the poppy, the opium, and then it's cut with all these other things. And meth is, in my understanding, a concoction of a bunch of like horrible stuff, like just chemicals. So when you say purity, can you help me? If somebody asks that question, what do you mean by purity? I don't know how to describe that because I don't know what meth comes from. I've always understood it to just be a bunch of chemicals. So what makes it pure particularly?
Less filler that's being added into the drug. You're seeing it more refined down to just including the more toxic chemicals that composed of meth.
Okay, so the purity is actually the chemicals, and something, the cut is just buffer or things that don't make you high.
Correct. And what's probably the best way to compare it is what you're seeing across the country in regards to THC levels from years and years ago when it was under 10% THC, now to all the way up to, the best example would be the THC ice, which looks very similar to meth, is up into the upper 90 percentile of purity, just like we just talked about here. That purity is what is causing the psychosis in many individuals across the country. Did that help?
Yeah, it does. I think I understand. Thank you.
Okay. This is one of the other disturbing things that we're hearing and seeing now is that the trend is people, even younger people, who are using some of these as a stimulant and occurring on the campuses. They're now mixing them in with juice. It's their speed to get them through cramming for exams, not realizing exactly what they're getting into and the long-term and short-term consequences of getting involved with meth. But the smoking is now still a factor, but now they're ingesting it as well and taking it with juice or something else that would be suitable for them. Go ahead, Ivy. Mixing of the drugs is never safe, but this is another one that I would strongly encourage you to talk to your fatality review team if you have one in your region, because what we are seeing here is for the last several years is a combination where we're finding heroin. We are also finding methamphetamine. Here they're referring to it as the methamphetamine as their medicine to help them get through the withdrawal symptoms from the opioids. So it's a deadly cocktail that many of them are now starting to utilize to go on with their day-to-day life. And here we have over 50% of overdose deaths involve polysubstance use or more than one drug. We just did a review on our 2020 cases, and over 50% of ours that were resulting in a death were opioid and methamphetamine. So if you can relate your local data to it, all the much better. Some of them that we're talking about that are getting mixed is the fentanyl and the heroin, fentanyl and cocaine, heroin and methamphetamine, which is the one that we are seeing here most often, and then the opioids and benzos. So it's a deadly combination that they're using. And the next slide will tell us about some of the aspects of it is why. Some of them enjoy the combined effects. How, I'm not sure, but what they're seeing also is with other individuals around them using it. But it's helping, as I said earlier, it's helping them balance out the effects of each other. It's a dangerous balancing act and to help with the withdrawals, but it also, if they're on the opioids, the depressor, it'll help them, stimulate them to get through the day-to-day living aspects that they have to do. They may be using meth in the morning to go into work and get through their work and go right back into the opioids in the evening. This is just a short video, and I think go ahead, Ivy, if you would.
First to make it to college.
Finally got his own place.
Would do anything for his friends.
Fentanyl doesn't care who you are, where you live, or that you're a good person. Fentanyl hides in meth. It takes just 2 milligrams to kill, and the body count is up 68% in the past year.
He was always such a good boy.
Learn more about fentanyl-laced meth at the website.
It's a good short video, and it falls right into what I mentioned earlier is the alarming trend where this is becoming very popular in the college environments, just to help them get through their studies, their testing. And it's a dangerous combination that unfortunately the long-term effects are going to be pretty significant on these kids. Go ahead, Ivy. And these are some of the consequences that you can go through and talk to them about it. If you've known anyone that's been involved with methamphetamine, we have had it in our family as well. So it brings it to home, and you can relate to these different things. I like to go through the short-term effects first, and those are the things where we hear of the individuals that have been up for a couple of days without sleeping, without eating, because that doesn't become anything of value to them anymore. They have a decreased appetite, significant weight loss, oftentimes, very fast irregular breathing, which goes along with the irregular heartbeats. And you don't have to go through all of these, but the skin sores is something that we always looked for in the past that doesn't always occur now. So it can be just like, the cards that we've made up, the flyers we've made up is the new individual that's suffering from a substance use disorder that's related to methamphetamine may not look like the individuals that we associated it with before. And the paranoia is significant that occurs with these things. And we've got added in here the psychosis that's coming, some of the mental health issues that we are encountering now from this. Just a short term is going to be as significant in the long term. Long term, the damage to the individuals is significant. We're dealing with a young lady up here who ended up being rushed into Las Vegas University Hospital and had to undergo some significant surgery based upon long-term health effects she had from her use of the methamphetamine. But all of these will be related to it. And we've all heard of the dental problems, those things that can relate to it. But the short and long term, really, such negative impacts on the body all the way across. Go ahead, Ivy. What can you do about it is some of the things that we can talk to the individuals about in the presentations as to how they can make a difference, either as an individual or as a coalition. Prevention is something that we really hit on. There is no one key. I wish we knew what exactly that was, because it'd be much easier for all of us. But talking to them about the things that we talk about in all of the other substances that we're dealing with is trying to prove and show them healthy choices, and no drug use is the best use to take place. Screening intervention, identifying those that are in need, and taking action with them. If you have somebody in your work environment, in your family, do what you can to intervene and try to make a difference and get them pointed towards recovery. Because that's the one thing you've heard for many, many years is there is no proven treatment program for methamphetamine. And in fact, there are programs out there now that are working, and individuals can, and I can attest to that from our family aspect, can recover from methamphetamine and can move forward with a productive life. Not going to lie, some of those long-term conditions remain and exist, and those are things that you'll have to learn as an individual to work around. It's not impossible to work around those. Go ahead, Ivy. Talk about early action, talking with your children early and often about the healthy choices and the dangers and things that can come with it. Healthy rules and consequences is something to really, really push forward. We've had some pretty good coverage here. Thanks to everybody from SACLA that's put in all of the time on the social media aspects, because those are definitely coming into play up here in our community. But talking to them about having curfews set, limiting screen time and online time, and most of all, being aware of what is occurring in there. Treating for depression and anxiety and mental health is huge right now. I think it's on all of our lists in regards to things coming out of the COVID haze as to what the impact is. And quite frankly, we're going to see that effect for many, many years to come. And it's going to keep us all, unfortunately, very busy. But promoting good school success and goodness grows, just keeping it on a positive life aspect is what we're trying to push with the kids and the adults that we're going to be talking with. Another short video.
Using meth taught me everything about freedom, only not like you think. It taught me how easy it is to lose your freedom, how meth can take control until you find yourself doing whatever meth tells you to do. Before you get there, while you still can, take a stand for yourself. If you feel yourself losing your freedom to meth, ask for help. Accept the help. It's worth it. You have the power to be truly free and be the person you want to be. I know, I'm Jan, and I'm free from meth.
If you or someone you know is struggling with meth, call 1-800-662-HELP for 24-hour free and confidential treatment referral. Learn more at samhsa.gov/meth.
Like I said, it's just a short video, but I think it emphasizes that recovery is very possible, because so often we hear, well, there is no coming back from the methamphetamine. And in fact, that is inaccurate. And there are opportunities out there to be able to help individuals overcome that disorder. Go ahead, Ivy, if you would. These are things that I really hit on when I'm doing the presentations, is the myths and the realities, because we hear about it in all aspects. Doesn't matter if it's methamphetamine, fentanyl, opioids, whatever we're talking about out there, that he or she can stop if they really want to. And in fact, we know that to be different based upon our experience, obviously, that it's a disease and it's not a choice. It's not a selection that people choose to become addicted to these types of drugs. And the one that I've heard multiple times, people need to hit rock bottom before you can make a difference. And that's not true. Acting sooner is better. Getting them in the right direction, convincing them may be a little bit difficult, but the sooner that you get involved with it, the better. And I always use here, one of the programs we have is an early intervention court. And what I've always talked about is with drug courts, which strong supporter of, but to me, it always struck me as it's kind of at the end of their last chance. In other words, you're either going to go into drug court or you're going to go into prison or jail for a very long time. To me, that kind of was like, well, we recognize you have cancer, but we're going to wait till you hit stage 4 before we begin treatment. We need to start when they're in stage 1 and try to turn that around and improve their quality of life. Treatment won't work. We just talked about that. And it can, in fact, do so. And addiction is hopeless and untreatable, and that is not true at all. It's a fallacy and something that we need to emphasize over and over to the individuals. Multitude of different aspects. I refer people to our SACLA website multiple times, not just here in the community, but other grants that we're involved with and other organizations across the country. We share our SACLA website with them, and I can tell you it's being utilized a lot, and we can be very proud of all of the work that everyone here has done, because it's not just being used in our state, it's being used across the country. Something we can be proud of and hopefully can help make a difference in regards to addressing these issues. Again, a few more sites for the people to go to and to check on to get additional information. SACLA is one that I always use, newmeth.com. And go ahead, Ivy, if you would. I believe that's it.
Yes, that's it.
Okay, if anybody has questions related to this one, please let me know. I'm not going to by any means portray to be an expert in this, but have been doing the presentation now several different times, and it's been quite well received in that regard. And I know Amy mentioned the trigger. I think that's a good aspect, because one of the presentations I did, not one, a couple of them, individuals had actually family members that were involved, and it definitely has an impact on them. Any questions at all? Wow, quiet Friday. Okay, then we're going to move right into naloxone, if that's good with you. This is a presentation I've done multiple different times, and I know we are now approaching 900 naloxone kits that we've distributed throughout our community, and it's something I believe very strongly in. And I'm going to have to admit, I goofed. I was supposed to have my little naloxone kit here to show everybody, because I always have them with me wherever I go. But this is one that I feel very strong about in regards to our naloxone. Go ahead, Ivy. This is naloxone, and I think, to be honest with you, one of the obstacles we had here before we were able to get into our schools is often individuals think of naloxone as the EpiPen, the injectable. And what we are distributing, thanks to the Department of Health Services, is the nasal spray. So when I actually made an appointment with our superintendents, I went in with the box and took it apart and showed them exactly what we were talking about. And that seemed to be a turning point in regards to the schools being more flexible and more open to having naloxone inside there. And it's important to point out that it is a 2-pack kit, and we'll get into that as we get moving forward. This is a short video that I think is excellent from the Tucson area. And we'll talk about some of these points when we get a little further here into the program.
Is there supposed to be sound?
Yeah, sound will kick in here in a minute. He's approaching up to the scene, and you'll hear the sound kick in once he activates it. So good point, Ivy. It's just something to mention to people that may have a question.
Hello? Is he in here? How many pills did he take? I don't know. No. Was it oxycodone though, for sure? Do you guys know if he uses any type of heroin? Here, let me go ahead and sit over here for me, okay? For sure it was that's oxycodone. That was the bottle. Okay. This works.
Pay attention as to where he,
Wake up, brother. It's the
how
police.
things are going.
It's the police. You okay? 2 Adam 77. It's the police. Don't freak out for me, okay? I just administered Narcan, and he's conscious again. Meds is en route, correct? 10-4. You alright, man? What's your name? Huh? Paul Hernandez? You know where you are? No? Why'd you take the pills? Were you trying to hurt yourself? Yeah? What's going on, brother? Too much? Well, we're here now, man. I know I'm a cop. You're not in any trouble or anything like that. We gotta take you to the hospital though, okay? You guys are mom and okay. No knives on you or anything like that, right, man? No needles or anything? Okay. The medics are on the way, okay? Are those prescribed pills to you, or did you just kind of? Okay. What do you in pain for that they prescribe those for? Other one. Just hang tight, alright? The medics are on the way.
Okay, you can go ahead and advance it. We'll talk about some of these points here as to what we just saw as we go through, because I like to refer back to that video. I think it's an excellent video. The officer did a great job in regards to that in encountering it. But we talked to them. Yes, I'm sorry.
I'm sorry to interrupt. There was a comment on the video.
Okay.
Someone said it seems like he only gave 1 dose of the Narcan in the video. Is that accurate?
That's correct. That is correct. And we're going to talk about 2 doses here in just a little bit, because this video is a little bit older. And unfortunately, what we're seeing now with the fentanyl in there, it's requiring a little bit more. And we'll talk about that. But we talk about the signs of overdose with the crowd in regards to the deep snoring, gurgling. There may be little to no breathing whatsoever. And the question that you may get hit up on is, well, is it going to work if they're not breathing at all? And the medical answer for that is yes. It will still absorb through the membranes and will still be effective in regards to reversing the opioids. They can have blue, gray lips, very pale in color, unconsciousness totally, or just an inability to wake up, like they're in a sound sleep that you just can't get them awake from. And that was one of the things, if you recall from presentations before from San Luis, is in talking with the police department down there, what the teachers were encountering as the kids, they thought were going to sleep on their desk. They were tired, but in actuality, it was an overdose. So you get slow to little to no heartbeat whatsoever. And what I usually ask the crowd is many times, how many in here are CPR certified? And quite frankly, I've been pleasantly surprised as to how many have taken CPR courses and know what they're doing with that. But it's the same thing as if you've taken a CPR course, is to check responsiveness. Ask if they are okay. If you remember with the mannequins, shaking them, Annie, are you okay? And kind of shake them, and then performing a sternum rub. And I demonstrate to them how to, in effect, do a sternum rub and what it will do to the individuals. So you want to look, see if they're breathing, look, listen, and feel, if you recall from CPR. But here's the first thing that we tell them as well, just like when you're dealing with all of these, is call 911. if they're not responding or breathing. That should be the very, very first thing that you're emphasizing to the crowd, is make sure someone is calling 911. And if you recall, if you've ever been through CPR training, or if you haven't, one of the things that is highly recommended with that is, if there's a group of people around and you just say, call 911, you really haven't given anybody that responsibility. If someone has a phone, or you can't see a phone, point to a particular individual and say, call 911, so that the group isn't standing around thinking someone else is doing it, and someone in actuality is making that call to get the first responders on their way. Then we get into how to use the Narcan and the naloxone, and it's removing it from a box. What I highly recommend, and we've been very fortunate here with the relationship with the police department in getting their expired kits. And I use those when I go in and actually take the kit apart and do the whole aspect of it, instead of using a true, a good kit, a non-expired kit. But showing them through how to peel back the tab, and then how to hold the dispenser within your hand. What they then do is take the tip of that nozzle and place it in one of the nostrils on the individual and press the plunger. And that's where I do it in a demonstration. If you can get expired kits, that would be phenomenal, because you can depress it right there and they can see the spray that comes out, and it gives them that visual as to what's occurring. You then remove the plunger, indicate to them, and this is a big thing, and I'm not sure who mentioned it, but yes, if there is no reaction within a couple of minutes, I recommend 2 minutes. That is when you give the second dose of naloxone in the opposite nostril. And what we are seeing and what we are hearing here in our community, because of the prevalence of fentanyl mixed in with everything, is that it's requiring a second dose to get them going. Hopefully by that time, EMS has arrived on the scene. And if we can go back to what if they don't respond, like I say, you go through the steps all over. But the other aspect, and a question you may get, is I've heard that individuals may become very violent, and that is true. It's not the most common, but it can be true. Most of the individuals that we've seen, that we've encountered here, are very lethargic, just like we saw in the video. So those are things that people can be aware of, but they do need to make sure that they take care of themselves as well. Have you go ahead. Injectable. I guess you can run through it if you would like. I don't know of anybody right now that's handing out. I believe Sonoran Prevention is still handing out the injectables, but I believe they're the EpiPens. But we do have some instructions here as to how to move through the naloxone use if it's an injectable. Go ahead, Ivy. This is a section that I typically skip over, because what we're supplying to the individuals when we're doing this training is the nasal, which is much more, I found people are much more willing and amenable to taking the nasal versus the injectables, because I've heard that multiple times. They're just not comfortable jabbing somebody. And the other part of that is, as it mentions here, is afterwards is what to do with the injectable, and you have to make sure that it's carefully disposed of. Go ahead, Ivy. This is something, if you recall, going back to that video, remember the individual was already in a recovery position, getting them on their side just in case there's any vomiting that may occur. But here's where I would emphasize as well, and I talk to the individuals when I'm doing the presentations, is watch out for yourself. First and foremost, if something happens to you, nobody's going to save that individual, and you may put yourself at risk. When you kneel down by these individuals, make sure you're not kneeling onto an injectable if in fact they've taken heroin or something else to that effect through an injectable. Watch out for powder in case there's powder fentanyl in that particular area. Again, first and foremost, watch out for yourself. Get them in that recovery position. So as you saw in the video, once he did the one administration, you saw how quickly the individual came back. Sometimes they do come back just that rapid. Other times you may see a delay, and where you would have to go into a second dose if necessary. This is something that also comes up in every one of the presentations I've done is the Good Samaritan Law, and worrying about what if this individual isn't really having an overdose? What if it's a different medical aspect from there. And we do have the Good Samaritan Law in the state, and it does protect you from administering the drug. And the other thing that you can indicate to them is that there is no harm. I tell people the worst that you're going to do is give them damp sinuses if in fact they're not actually in a opioid overdose situation. So I think that is reassuring. And we've also had advice from Banner Hospital in regards to what about younger children, and they are given the clearance for us to be able to administer it. Some things come up under this as well as what if I have an expired kit? And when I was at the police department and we implemented our naloxone, we did our best to make sure that the kits were processed and kept up to date, but some do slip through. And our advice to the officers was do it anyway. And that's been verified by medical staff, because the worst that can happen with an expired kit is that it loses its potency, but you're at least getting something into their system, because at that point, something is better than nothing and they're dying. So any intervention that you can do is going to be for the benefit of helping that individual. Good. Just a flow chart for you to use, when to use naloxone. If you suspect an overdose, they're not responding, the breathing, that's when you know to move forward. And it just gives a nice little flow chart. And if you look on the kits themselves, there's actually a nice little how to use guide. Plus, SACLA has the cards, and I highly recommend the small postcards that were developed by our group is to distribute those. Every naloxone kit that goes out has one of those postcards when I distribute them in the community. And this is the big thing, is being prepared to reverse an overdose and reducing that stigma. And folks, I know we can do it because Mojave County, as all of you know, is a rural, very conservative, sometimes ultra conservative county. And to actually be invited to speak at the Conservative Republican Club, I can tell you I did this presentation for that organization, and I ran out of naloxone kits there from individuals taking them. So we can overcome that. And the more that we go out and speak of it as a disease, and not as our chief here has now referenced, thinking back into the decades ago of you picturing the heroin user passed out in an alley with a needle in his arm. That's not the case anymore. And we need to be the ambassadors for this. And together, by doing these trainings and getting the naloxone out there, we can save lives. We've literally saved thousands already, and we can save more. One question you may get as well is, and I've heard it before, is, aren't you just postponing the problem? Because they're just going to do it again and again. And I will tell them that it may in fact occur that way. It may be 1, it may be 2, it may be 5 before an individual will actually seek help. But I refer back to our harm reduction programs that we have going in the community. And the individuals that actually get involved with the harm reduction are 7 times more likely to follow through and receive treatment. I can speak to the fact of an individual here that we did a reversal on, went through our drug court, and I can recall him standing up there at graduation that I was at and thanking the department for giving him a second chance at life. So if you have those kind of life-altering stories that you can relay, I strongly encourage you to use them, because those are the kind of things that sink home with individuals and make them realize that this is truly a kit and a procedure that we can do that can save lives. And in 40 plus years of law enforcement, I can tell you this is probably the easiest first aid life-saving aspect that is out there, and is easy to apply really as a Band-Aid. And if you've got a first aid kit, you need a naloxone kit. And with that, I would be happy to take any questions.
Bob, this is Vicki Solomon. Thank you so much for your time and putting this together and doing this training for us. It's greatly appreciated. And I just wanted to share something real quick. I was able to go to one of our local school districts, Blue Ridge School District, and they had 200 of their staff in an auditorium. And I did the Narcan training, and we made sure that their needs were met. And the day that I had that training, I had all kinds of phone calls and emails for other things and other services and thank yous and stories about their family and overdoses. And it was just a really super neat experience. And I loved everything that you hit as far as making sure that they know, doesn't matter the age, doesn't matter if they have any health, challenges, make sure that you administer it. It's not going to hurt them. And that was something that almost everybody in, out of the 200, they were not aware of that. And so thank you very, very much for that emphasis.
Thanks, Vicki. Any other questions?
So this is Raylene. I wanted to clarify or get some clarification. So when we've done the training on Narcan or naloxone, when we've talked about going up one nostril and wait 1 or 2 minutes, and then if there's no response, go to the other one. Now, the reasoning behind that, I kind of thought it was if there was a blockage, but it's actually fentanyl that's making it harder to I guess have the efficacy that it's harder to wake them up. Is that right?
It could be both, to be very honest with you, but what we are encountering here is it's based upon the potency of the fentanyl that we're experiencing, that they need higher. And your first responders actually have a stronger version on board, and some of the individuals here have actually ended up on a naloxone drip in the hospital for some time afterwards. So it's the potency that we're seeing in our area, but it could be both.
Wow. Okay. Thank you.
Sure. Any other questions? No, I want to thank you very much for helping me out with this and getting it out. I tell you, this has been probably one of the most rewarding experiences for me, is being part of this SACLA group and seeing what has occurred in regards to developing this material in a very short time period and getting it out onto the streets. So it's kudos to everybody that's involved with this project. I'm very, very proud to be one of them.
Thank you, Bob, for taking the time to train us this morning. You did great. So there's a lot of thank yous in the chat.
Good. Well, I appreciate it. And if there's any questions or anything, please feel free to reach out. I'd be happy to answer them as best I can. But as I promised, it wouldn't take 2 hours to go through them. I think what you find is, we went through this fairly quickly because many of us have had exposure to the program already. And I didn't want to waylay the fact, but you'll find when you're actually doing it out in the community, it does take a bit longer, especially based upon the questions that come up.
Do you want me to put your chat in the box or your email in the box, or
you would please? Yeah, I'm sorry.
Okay.
Thanks,
All right.
Ivy.
You're welcome.
Thank you, everybody. I hope everyone has a great weekend.